Dr. Mike with Prototype Health. You're about to watch a video of another patient that struggled with neck pain. She had been to a chiropractor before for headaches very effectively, however, hadn't been for a while, and then just kind of woke up, and over the course of a couple days her neck was impossible to move. The little caveat about her care is she chronically adjusted her neck. So we're dealing with some hypermobility issues, and as a chiropractor you have to adjust very differently, very lightly, to not over adjust certain segments. Now luckily we tested to see which segments were hypermobile, and it was her upper cervical spine. Okay, the dysfunctional segments were in her lower part of her neck, so you're going to see the adjustments a lot lower on her neck, and she was turning her head and she couldn't adjust that, so it was making her neck pain actually worse. So you'll see that in the care. Hope you enjoy the video. So Lauren's presenting to us today with some neck issues. She started to get some really bad stiffness, couldn't turn her neck, all those things that a lot of people are dealing with. The very interesting caveat about her is that she has always been adjusting her own neck, constantly turning her neck and popping, constantly doing all that stuff. And the more she was doing that, the worse the pain was actually getting for her. And what we found on her x-rays, and I'm going to show that to you guys at the end of the video, is why her popping her neck and why that wasn't working and why it could actually be making it worse. So I'm going to go through her whole spine, figure out what's wrong with her today. She has been getting better, but we still need some improvements every single day. So let's see what we can fix today. Drop your arms all the way to the floor for me, and all the way out for me. Good, perfect. Let's take a deep breath in, all the way in, and all the way out. I'm going to move your head over just a bit. We're going to go straight down. Perfect. Okay. Same thing here, just relax a little bit. Good, perfect. On your back for me now. Makeup is all over my table.
Everywhere, always.
It's okay. So the interesting about Lauren is that she also likes to watch YouTube videos of people getting their neck adjusted. So now she gets to be the person that gets her neck adjusted on camera. Yeah, I don't know about that. Like 10 people will see it. But it is very educational to see somebody else get adjusted, because a lot of times you only see the pops and you hear these loud cracks. You think that's what we're doing, and that is part of it, but that is not everything that we're doing for Lauren here. So. So we just adjusted C7, and the difference between her neck pain and why her turning her head and all this stuff wasn't helping is because when she was adjusting her neck, she was only adjusting these upper cervical segments, and it wasn't affecting the lower cervical segments. So I'm going to show that on her x-rays in just a bit. There you go, a little more on this side as well. Wiggle your toes for me. Sit all the way up for me. Go run that way for me there. All right, we're gonna do a little turtle tuck exercise. So we're gonna do it together. Okay, you're gonna stick your chin as far as it'll go, and you're gonna give yourself a double chin. We're gonna do these together.
The reason I have the patient do these turtle tuck exercises is because it helps retrain the position of her neck. She has a forward head posture, and this allows us to retrain the muscles to bring the head into a proper position, but also to help get movement back into those joints that have been dysfunctional for quite some time. I use this arthroStim unit as a way to put a repetitive force into C7 and T1. Those were the joints that we found to be dysfunctional in the patient's neck, and this allows me to make a longer lasting correction so that the patient can live without pain while she's at work.
Hey guys, so I'm gonna pop up this x-ray here and you're gonna see how she has a forward head posture. And what I mean by that is her neck is pushing forward like this. A lot of desk workers, a lot of people that sit at a computer for 3 to 4 hours a day or more have this chronic issue where their necks tend to lean forward. This can cause an immense amount of pain in the back of your neck, and it can also influence headaches, balance issues, stuff like that. So it's very important for her care and for many of you guys that if you're sitting at that desk, we got to do some retraining exercises to help bring that neck back into a proper position. So I'm going to show you some of the quick exercises that we do in the office, and then some of the stabilizing exercises that we do to strengthen her neck so that she can, once we get her pain free, she's not back in the office in 6 months with the exact same problem. That's what we do at Prototype Health. We want to make sure our patients are finished products when they're done so that when they have to come see us again, it's not for the exact same problem.
After the patient's adjustment, I have her do a zero gravity hold. This is just a cervical stabilizing exercise, which allows us to retrain those muscles in her neck that have become weakened due to the injury in her neck. We need to retrain these muscles because the patient for so long had been adjusting her own neck, which creates an instability. This will allow us to have long-term success with her neck so that the same problem doesn't come back in 6 months. We change the position for the patient to get new muscles incorporated in the stabilizing exercise. And we finish off her visit with a movement exercise that gets all the joints of the cervical spine moving properly.
I hope you guys enjoyed this video. If you have any questions, put them in the comments. Be looking for more videos in the near future. And hope you guys are living your life without limitations.